हेलो फ्रेंड्स, वेलकम टू क्लासेस बाय लैब डॉक्टर। आज के क्लास में वी विल सी व्हाट कॉजेस प्रोटीन्यूरिया। ये जो यूरिन में प्रोटीन एक्सक्रीट होते हैं, क्यों होते हैं, व्हाट आर द कॉजेस फॉर इट। So proteinuria can be classified as physiological and pathological. Physiological मतलब there are few benign conditions like अगर patient को बहुत stress हो गया, या तो patient has gone to a very cold temperature, he is having fever, या patient is dehydrated, patient ने कोई high intensity activity कर ली जिससे कि उसका किडनी का blood flow ज़्यादा हो गया and he started excreting some amount of proteins in his urine, or there is an acute illness, or there is an emotional stress, or there is orthostatic proteinuria. All these are physiological causes of proteinuria. And similarly we have pathological causes. अगर ग्लोमेरुलस में कोई डैमेज हो गया, ट्यूब्यूल्स में कोई डैमेज हो गया, या देर इज एन ओवरफ्लो प्रोटीन्यूरिया, दिस कैन ऑल कॉज प्रोटीन्स इन द यूरिन. So proteinuria we can divide, or it can be caused because of a renal disorder. मतलब किडनी में कोई प्रॉब्लम है, किडनी आइदर बेसिकली किडनी में हो, या ग्लोमेरुलस में हो, ट्यूबुलो इंटरस्टिशियम में हो, या तो किडनी का जो ब्लड वेसल्स है उसमें हो, या तो देर इज एन ओवरफ्लो ऑफ एबनॉर्मल प्रोटीन्स, ज्यादा एबनॉर्मल प्रोटीन्स है ब्लड में, लाइक इन केस ऑफ मल्टीपल माइलोमा. सपोज इट कुड बी ऑल्सो बिकॉज ऑफ ए नॉन रीनल डिसऑर्डर, किडनी डिसऑर्डर नहीं है, पेशेंट को कोई और प्रॉब्लम है लाइक अमाइलोडोसिस एक्सेट्रा. That can also lead to proteins in the urine, and as I've already told you, the physiological conditions. So we classify, or we divide the proteinuria as glomerular proteinuria, which is mainly albumin, tubular proteinuria because of the inability of the tubules to reabsorb certain proteins. So you will get in like heavy metal poisoning etc, you will get such a tubular proteinuria. Overload proteinuria, zyada amount of proteins are there in the blood like multiple myeloma, hemoglobinuria etc. And post renal proteinuria because of malignancy or inflammation, or because of an stone etc. So the proteinuria can be divided into glomerular because of glomerular dysfunction, or because of tubular dysfunction. Glomerular dysfunction में जो proteinuria होता है, that is because of damage to the glomerular basement membrane. And इस condition में majority of the protein जो urine में leak होता है, that is albumin. And ये glomerular basement damage can happen due to diabetes से हो सकता है, amyloidosis से, collagen disorders से, एंड टॉक्सिक एजेंट से. सिमिलरली जब हम ट्यूबुलर डिस्फंक्शन बोलते हैं, दैट इज tubules are not able to reabsorb the protein. This can happen in case of alpha microglobulinemia, beta microglobulinemia etc. So this pathological proteinuria which I was telling could be because of an overflow, could be tubular dysfunction, could be glomerular dysfunction, or a post renal proteinuria. So we will first see about the glomerular proteinuria. See, this is the most common type of proteinuria जो हम देखते हैं. तो most commonly जो proteins हम urine में देखते हैं, that is because of the glomerular damage. क्योंकि ये glomerulus में either capillary permeability ज़्यादा हो जाता है and the proteins वहाँ से leak होने लगते हैं, especially albumin. For example, अगर 24 hour urine में आपको more than 1 gram of प्रोटीन आपको मिल रहा है, देन यू हैव टू सस्पेक्ट ये कहीं ग्लोमेरुलर डिसीज तो नहीं है. एंड अगर आपको मोर देन 3 ग्राम्स ऑफ प्रोटीन्स मिल रहा है पर 24 आवर्स, दैट इज इट कंफर्म्स द ग्लोमेरुलर cause. So I have told you this glomerulus has a basement membrane. Either basement membrane में leakage हो सकता है, या तो the endothelium can be damaged, or the podocytes they can have the detached food processes which can lead to escape of proteins from the glomerulus. So what are the causes for such all the conditions which can occur in the glomerulus? It could be because of glomerulonephritis, nephrotic syndrome, polycystic kidney, या तो amyloidosis, diabetes mellitus, SLE, malignant hypertension. They can damage the endothelium or the food processes, or they can damage the basement membrane, causing the proteins to leak in the urine. Second is tubular proteinuria. This is because the tubules are not able to absorb the normally filtered protein of low molecular weight, जैसे कि immunoglobulin हो, उसको वो absorb ही नहीं कर पा रहा है, and that is why they are getting excreted in the urine. Suppose if you are getting your 24-hour urine protein is less than 2 to 3 gram of proteins, and उसमें भी अगर वो low molecular weight proteins है rather than albumin, you should always think of tubular proteinuria. So albumin जो रहता है वो ग्लोमेरुलर डैमेज में रहता है, लो मॉलिक्यूलर वेट मिल रहे हैं, तो यू शुड थिंक ऑफ ट्यूबुलर प्रोटीन्यूरिया. सो व्हाट आर द कॉजेस फॉर ट्यूबुलर प्रोटीन्यूरिया? इट कुड बी बिकॉज ऑफ एक्यूट एंड क्रॉनिक पाइलोनेफ्राइटिस हो सकता है, रीनर ट्यूबुलर डिसीज हो सकता है, विल्सन्स डिसीज, फैंकोनिस सिंड्रोम, इंटरस्टिशियल नेफ्राइटिस एंड सिस्टिनोसिस. Third would be overflow proteinuria. Overflow proteinuria is there is an increased concentration of proteins, abnormal proteins in the blood. That will lead to increased glomerular filtration of those proteins, and that will exceed the tubular capacity to absorb it, and hence the condition called as tubular overflow proteinuria. This happens typically in cases of multiple myeloma. So this could be because of Benz-Jones proteinemia, which is seen in multiple myeloma, or amyloidosis in case of myoglobinuria, and also because of hemoglobinuria. So these are, I have already told you, the benign causes, which are, or the short term causes. For some time only you will see the protein is excreted in the urine. Like, you know, if you have if patient is dehydrated, या patient को बहुत stress है, emotional stress है, he's in a very cold temperature, he's having fever, or if he has done a very high intensity physical activity, etc., which also will cause increased amount of protein in the urine, but that will be for a short time and it will resolve on its own. That is called as benign proteinuria. And so when we come to pathological proteinuria, it will not resolve on its own until and unless we intervene. And ये जो है pathological proteinuria, it can be because of glomerular में कुछ problem हो, like in the glomerular basement membrane में जो most common causes है glomerulonephritis, primary glomerulonephritis या secondary glomerulonephritis. Diabetes is one of the conditions which will cause damage to the glomerular basement membrane. BP, hypertension से glomerular basement membrane damage हो सकता है, and chronic kidney diseases में भी ये glomerular basement membrane damage होता है, and we see that patient के urine में हमको प्रोटीन मिलते रहता है. तो ये मोस्ट कॉमन कॉज है, एंड मोस्टली 80% ऑफ द टाइम में ये जो प्रोटीन निकलता है इस कंडीशन में, दैट इज एल्बुमिन. सो दिस इज द ग्लोमेरुलर प्रोटीन्यूरिया. सेकेंड इज ट्यूबुलर प्रोटीन्यूरिया, जिसमें जो लो मॉलिक्यूलर वेट प्रोटीन्स है उनका एब्जॉर्प्शन ठीक से नहीं होता है ट्यूब्यूल्स में कोई प्रॉब्लम के वजह से, लाइक इन केस ऑफ ट्यूबुलो इंटरस्टिशियल डिसीजेस. थर्ड वुड बी ओवरफ्लो प्रोटीन्यूरिया. किडनी में कोई प्रॉब्लम नहीं है, बट सीरम में ही, ब्लड में ही देर आर सो मच ऑफ प्रोटीन्स, द ग्लोमेरुलर मेम्ब्रेन उसको फिल्टर ही नहीं कर पा रहा है, ट्यूब्यूल्स उसको एब्जॉर्ब ही नहीं कर पा रहे, उतना ओवरफ्लो हो रहा है वो प्रोटीन, एंड बिकॉज ऑफ दैट देर इज प्रोटीन इन द यूरिन, विच कैन हैपन इन केस ऑफ मल्टीपल माइलोमा, लाइक इन केस ऑफ बेंज-जोन्स प्रोटीन, in case of myelomonocytic leukemia, wherein the lysozymes become so much that they are excreted. In case of rhabdomyolysis, जब मसल का ब्रेकेज हो जाता है तो myoglobinuria happens because the excess of myoglobin is excreted in the urine. And in case of intravascular hemolysis जब होगा, RBCs are broken down in excess, then also there can be increased hemoglobin which is excreted in the urine. So, and the last cause of proteinuria, pathological proteinuria, would be post-renal proteinuria. That means suppose if there is a urinary tract tumor, if there is a stone, if there is a cancer, or if there is a urinary tract infection, or if there is a severe inflammation in the urinary tract, that can also lead to proteinuria. So these are all the pathological causes of proteinuria. So you should remember the proteinuria is classified as physiological and pathological. Physiological is short term, after some time वो अपने आप में resolve हो जाएगा, but pathological वो we cannot resolve it unless and until we intervene, and that is because of glomerular or because of overflow proteinuria, tubular proteinuria and post-renal proteinuria. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.